I'm sure you've heard the term arthritis, but what exactly does it mean and how many different types of arthritis are there? Well, actually quite a few. You may have heard of rheumatoid arthritis, maybe psoriatic arthritis, and I'm sure you've probably heard of the most common type, which is called osteoarthritis. Osteo meaning bony. So arthritis of your bones, arthritis of your joints. So what is osteoarthritis? Well, it's really the aging process, right? It's how our bones over time, they undergo wear and tear, and those joint surfaces can often become irritated and roughened, okay? We can lose the cushioning and the tissue that surrounds those joints. And also, when it comes to, for instance, the spine, the intervertebral discs, those cushions in between the bones, all of that can deteriorate and eventually start to cause pain, decreased range of motion, and decreased ability to do the things that we like to do. So we can have arthritis really in the spine. We can have arthritis in our peripheral joints, like our shoulders or our knees, our elbows, our hands, fingers, all of that. Today, I just wanted to talk a little bit about the arthritis in the spine, and in future chats, we'll get to the peripheral joints and how best to take care of them. But when we look at the spine, okay, and here's one, we can see that we've got a grouping of individual bones. We've got 7 bones in the neck. We've got 12 bones in the middle back and 5 bones in the lower back. All of the bones in the neck, they go 1 through 7, and they start with the letter C for cervical, meaning your neck. In the middle part of the back, there's 12. They start with a T for thoracic. And in the lower back, they start with an L for lumbar. So we have 7, 12, and 5, right? So 24 movable segments. And with those joints, we have these discs, these cushions in between. Those help to create space. And that space between the vertebrae also forms the area where these nerves, right? These are your spinal nerves. The brain sends the information down through the spinal cord inside the column of the bones. The cord is that grouping of nerves. As it passes down, the body sends off one nerve, which goes off to the left side, one nerve that goes off to the right side, and this is like the fuse box to the body, right? The power comes from the brain down through the spine, and it's sent out to the body and controls everything, right? What do those nerves control? They control your muscles. They control your organ systems. Every system in your body is under the control of the nervous system, right? That's the master system. So if we can keep the nervous system healthy, that's a really good thing. One of the ways we do that is helping to limit the osteoarthritis or the bony arthritis that develops in the spine, right? If we can do that, then we're going to be able to move better. We're going to feel better and function better, do more of the things that we enjoy doing. And isn't that what life's all about, right? That's what we all want. That's certainly what we want for you, is to be able to enjoy your life. The more we can enjoy life, the happier we are. So we like to say that we work hard to keep our patients happy, right? Because we're happy when we can do what we want to do. When you ask your body a question, can I do this? You want your body to always say, yes, let's go. All right, and let's do more of it. Let's have more fun, okay? But we've got to do some things to make that happen. It doesn't happen by accident. Good health is not an accident. It actually takes some work, some effort, some diligence. But if we do that, the payoff is huge, absolutely huge. So when it comes to the arthritis in the spine itself, the way to limit that arthritis growth and progression is to keep the joints moving. Each of these joints is supposed to be moving individually and collectively as a group. When the bones get stuck, they start to irritate and pinch these nerves, but it also starts to affect the discs. The discs can't get the blood supply they need if there isn't proper motion of the vertebrae. We start to decrease the height of those discs, and lots of problems come from that. So keeping the spine moving properly can help to limit the osteoarthritis that forms in those joints. More joint talk to come. Thanks.